this morning we got a few more of the smaller donations. So yeah, we're hoping that we will get to 370,000. But our aim was to raise $350,000 to pay for both an echo machine that the Children's Hospital don't have, and to replace the lift that hasn't worked in maybe more than 5 years. So we've got a quote for that for $250,000. So the Children's Hospital get granted their two priorities.
So just 450 people you managed to get into GPH, and tickets were sold out. What is the message there to people? Definitely there's many people who want positive changes coming through.
Absolutely. The biggest supporters, of course, have been the corporates. So we had about 38 tables that were corporate organizations from Suva. So it means that they're happy to give us their money because it's obvious that they see the work that we do and the impact it has on the hospital, on medical staff, and of course the patients benefit in the end. It means that people really want to see change happening in the hospital, and if we're the ones that are doing it, then we're the ones that they will support.
I've spoken to you before. You've sometimes been in tears coming back from the hospital when you've seen some of the facilities with this money coming through. Does this uplift you to ensure that some of these much needed things that are taken for granted overseas, like echo machines and lifts working, does this uplift you to another level and make you do more?
Absolutely. Like, it not only makes me happy, like the doctors are absolutely thrilled that they've asked for an echo machine, which is so critical to children's health, and the screening of rheumatic heart disease prevention is better than us waiting around until a child is sick. They at the Children's Hospital, just FYI, is that they borrow an echo machine from internal medicine maybe every Friday to screen children with for rheumatic heart disease. So if they have their own machine, which they used to have, I'm not sure how long they haven't had one working. So once they have their own machine, and then every child that they suspect can be screened at that time that they've come in. These are just two things. I guess it's easier because we will just pay for an echo machine and pay for a lift to be installed. But obviously with all the other support that keeps coming in, we can still do the little bits of work around the hospital. Like we're still completing the oncology ward right now. And then we just keep looking for things that need change. And in August last year, BSP gave us $100,000, and that was specifically for the maternity hospital. So we will also begin work at the maternity hospital in the next couple of weeks, or by the next 2 months.
Much more needs to be done. What is your plan going forward after this project is over?
There's never enough work to be done at the hospital. Like, there is so much that needs to be done. Broken taps, replace sinks, fix lights, all the electrical works, the plumbing. It's never ending. So as long as we have the money, we're able to do the work, and I guess that's our benefit. We have access to all the money that we've raised from our events, and that allows us to do the work that we choose to go and do in the hospital.
Your message to the people who would be watching this here and around the world and interested in supporting this worthy initiative, what's your message to those from around Fiji and around the world watching this on Fiji Village?
First of all, thank you so much for the amazing support that we've received. Right? It's just heart-wrenching, heartbreaking that we seem so desperate for money to support our hospitals, but we're so grateful for everyone's support. We hope that people continue to support us, because the only way that we can make these changes is if we have the financial resources. Our work is okay. I mean, I'm happy to go and do the work. We just need the money to do it, obviously. But we are very grateful for the support. I mean, we had quite a few people in attendance on Saturday who had travelled from overseas to attend the ball. So that's an indication in itself that Fijians overseas are very interested in our health services, and hoping that there will be major improvements soon.